Hello and welcome to the Rise Up with Orion podcast. Thank you so much for joining us for a topic that I'm very, very excited about. We have Dr. Mike Bennett on our podcast as our expert today. He's a board certified dentist with 25 years of experience in general dentistry. Over the past decade, he's focused on treating children and adults for sleep-related breathing disorders and craniofacial pain at Advanced Dental Care in Provo, Utah. His experience lies in optimizing sleep quality for his patients to help improve their overall health. Dr. Bennett works closely with a team of healthcare providers to address obstructive sleep apnea and other conditions, emphasizing the power of sleep in preventing disease and promoting healing. I am so excited to have you here, Dr. Mike Bennett. Thank you so much for joining us.
It's really great to be here, Tara. Thanks for having me.
This is such an exciting topic. As many of our listeners know, I am our resident sleep nerd. So I'm glad to welcome you into the party. It sounds like you're a bit of a sleep nerd yourself.
Yes, ma'am. Let's get going on this.
Absolutely. So it sounds like I said, this was a really exciting topic as I was introduced to you to kind of bridge the two between dentistry and sleep. So I would love to know a little bit more about yourself beyond how I already introduced you and your dentistry experience.
Sure. Yeah, you bet. You bet. Oh, where do I start? Well, I would say I went into healthcare with the intention I just wanted to help people. I wanted to do it one-on-one, and I wanted to make a difference in life. And I didn't want to be tied to a pager. At the time, it was a pager or emergency room. So I decided against medicine and opted for dentistry for other lifestyle factors. Wanted to raise a family. I'm a dad of 4 boys and 2 girls, and they're all adults now. And back in the day when I was starting my career, that was important to me to just be involved with their lives as much as I could, as well as develop professionally. But early on in my dental career, as I was seeing patients, I was noticing that they had a lot of oral conditions that I just couldn't explain. I didn't understand in dental school, for example, when they identify worn teeth or notched areas around the teeth, or lots of extra bone growth around the teeth, or gum recession or excessive cavities. The approach was, let's just treat these conditions and then just send the patient on the way, and which is not a bad thing at all. It's a really good thing to do all that. But the deeper question was, what really could be at the root cause of these conditions? And that led me to looking into systemic connections with oral conditions. And it turns out that, for example, worn down teeth can be a byproduct of aggravated sleep. And it's just the central nervous system turning on to keep us from dying in our sleep. And our teeth just happen to rub against each other a lot. And sometimes there's excessive acid production, which makes them soft. And so they wear down even faster. And they have cracks, and you need crowns and root canals and all these symptoms that I was taught so well to treat. It turns out that those conditions possibly had a sleep issue related to it. So I was intrigued by that and looked into the research more. That led me on a journey to where I was starting to advise people just educationally, hey, you should get your sleep checked. We should screen you. Let's talk to a pulmonologist. Let's talk to a nutritionist. Let's see what we can do to maybe slow down this wear process. I'll make the crown for you, and I'll fix your fillings. I'll patch you up. But to keep all this expensive dental work from failing again, let's identify these sleep issues. So that's sort of the genesis of where I've been. And recently, about 12, 13 years ago, I left dentistry and spent full time and built a clinic that was dedicated completely to sleep disorders and chronic facial, cranial type pain, like migraines and primary headaches and that kind of thing. And more recently, I came back to general dentistry and brought all of those skills and that knowledge to my clinic at Advanced Dental Care. So that's
oh my gosh. And it's so interesting too. And we've talked about sleep on our podcast before, that it really does regulate so many other systems of the body. But let me tell you, I don't think we've ever thought about the connection between sleep and our teeth. So I'm so glad that you're bringing this to the table today.
Yeah, of
Um,
course.
Mike, tell me about the prevalence. I mean, is it pretty typical that people are coming? Because I know for me, I hold a lot of stress in my teeth, but again, in my jaw. But
Mhm.
how prevalent is that? That people are having a sleep dental connection.
Well, it's actually more prevalent than you would think.
Mhm.
And I would say, I mean, just the literature indicates that in an average dental office, about 58% of men
Mhm.
and roughly 30% of women show risk factors for sleep disorders. And
Wow.
those risk factors are some of the things I mentioned earlier, like cracked
Yeah.
teeth, worn teeth, excessive recession, bone growth around the jaws, et cetera. So that's significant. And I do think that in general, the population, as we become more and more obese as a nation, our airways are getting smaller and smaller as a result of that. But it's actually deeper than that, Tara. I've got a lot of really thin, slender people who have
Mhm.
severe sleep apnea. And
Yeah.
it turns out that it's an underdeveloped facial issue versus a fat issue. Fat just makes
Yeah.
it worse.
Interesting. Yeah. And for
So
those, that are listening today, tell us a little bit more about sleep apnea, what it looks like, what it sounds like, some of the things that you may, noticed from your seat.
sure. Well, sleep apnea has various conditions. Just straight apnea, apnea means no breathing, and essentially it's quiet. So like that.
Mm-hmm. Mm-hmm.
And but then there's variations where you can have hypopneas, which is partial breathing stoppage. If you stop breathing for 10 or more seconds and your oxygen drops 3% each of those times, then that's considered one sleep apnea event. And it could
Mm.
be full blockage, stoppage, or partial stoppage. And if
Okay.
you have five or more of those per hour, then you're considered to have obstructive sleep apnea if you're an adult.
Mm-hmm.
If you're a child, anywhere up to age 17, if you have 1.5 times of those per hour, then you're considered to have sleep apnea.
Yeah,
So
and typically, obviously, for adults, many those that are lucky enough to share a bed with us would probably notice that first. But other than going and having the sleep testing done, how would one know that?
how would you know to get a sleep test done?
Yes, or that, for children specifically, that's what I'm
Yeah,
thinking with my small children. If,
yeah.
they had this, how would we ever know?
Oh, I know, because it's not like you stay up all night and watch your kids sleep ever.
Yes, well, not anymore, thank goodness.
So, I mean, you can do a real cheap sleep test per se, and set and go into if you have an iPhone, download a free app called Snore Lab, and
Mm,
you get 5 recordings on that before you have to start paying. For Android users, there's I think it's called Snore Clock. You can download that and then put your phone by your kid's bed and then set your alarm so that you can go into their room around 3 a.m., 4 a.m., and video them for 15, 20 minutes while they sleep.
mm.
And I know it sounds kind of creepy, but this is good to
Yeah.
and then the reason you do it at 3 to 4 a.m. is because they're going into longer cycles of REM sleep. And REM sleep is where the skeletal muscle in the body loses tone and where the blockages often occur the most. It's usually in the second half of the night. In fact, more strokes and heart attacks occur during that part of the morning than later on, at night. And
Right.
it's thought to be for that reason. So anyway, do that. Record for a few minutes. Record and observe how they're postured, if their head is back, if their mouth is open, are they creating sounds? Of course, your snore
Mhm.
recording will record that. Any snoring is not normal. It's common, but it's not normal. And so you should have quiet breathing through the nose all night long, ideally for ideal sleep. And any variation from that means that can compromise your sleep quality and as a result affect the healing properties associated and growth in
Mhm.
the case of a child properties of sleep.
Yes, very interesting. Mike, what are some of the other kind of problems with sleep? Obviously, you mentioned, a lot of the things that you're seeing from the dental world.
Mhm.
I know for me, there is no question when I get a horrible night's sleep, what are some of the other problems that you're identifying, from, your dental seat?
Yeah. Oh, that's boy,
Sleep
there's
apnea being one of the big ones, I'm sure.
it is, strictly from an oral disease or dental condition
Mm,
standpoint. We often associate oral disease with a dry mouth.
mm,
And the
interesting.
dry mouth is often a result of two main things. One is if the sympathetic drive of the body is turned on too much, then that shuts down the saliva flow to the mouth.
Mm,
And so, guess what bacteria can stick to all night long?
yep.
It's going to be your teeth and your gums, and
Hmm.
they're going to infect. They're going to secrete acidic byproducts and destroy your teeth. If you have normal saliva flow, that washes away all those things and it kills those germs.
Hmm.
And so, if you have excess cavities or gum disease and those conditions that we're talking about, then one of the first things we look at is, well, can you breathe through your nose? And are you on medications that tend to dry out the saliva glands? Things like SSRIs and tricyclic antidepressants are very, very common associated with that. And how many people are on those medications? And so
Oh.
one of the
Mhm.
first things I check for in a new patient visit is, hey, what medications are you on? Because that's going to tell me your relative risk for developing oral disease. Yeah.
Sure. And I'm sure you may be going down this path as well, but in terms of, the things that we're eating nutrition wise as
Yeah.
well, making a
Mhm.
huge difference. As you brought up, dry mouth, I was thinking, oh, salt, something, that really would connect that way.
Yeah. 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 Nutrition is a huge component of that because if we're eating foods that are hard to digest, that are highly processed, lots of preservatives, then our body just has to produce excess acid to overcome that. And oftentimes we're malnourished because those foods have low quality or low quantity of nutritional value. And so, oftentimes, that excess acid production, especially when we're going through this abdominal pressure, let's say we're not breathing well, we're going to have a lot of abdominal reciprocal breathing. It's where our muscles in our stomach flexes a lot. And
Mm,
that can kind of milk that acid up into our esophagus and into our mouth and nose and
right.
produce a lot of those problems. And
Yeah.
so, eating foods that have a balance, have an alkaline base, is a real key component, to helping address those problems orally.
Absolutely. This is where I really become a nerd, and I'm going to let you give your very best expertise when it comes to sleep. But how can sleep enhance our lives? And then we'll kind of take a step back and say, well, how do we do better? So,
Yeah.
tell me, obviously, one of the biggest benefits is to shave off all the things that we're talking about. But how can improving our sleep really enhance or benefit our life?
And I have to say that I loved your website and your video that's on that. I went and did my little research on you guys, and
Oh, good. Oh, good.
I love what you're doing, and I think you've nailed it right now. The part of the key to health and well-being is a good night's rest. And
Mhm.
it's not just the number of hours of sleep, 8 to 10 for the average adult, but it's also the quality of those hours. You got to have both.
Mhm.
And so without, and it's also, I guess one way to put it is, it's also, if you understand, sleep is designed to help the human body heal
Mhm.
itself and prepare you for another day of living, because you're going to abuse your body, you're going to beat it up, you're going to work hard. Some of us are going to have vices that are going to beat it up even more, and then that's going to create an even higher need for sleep to
Mhm.
repair us and
Right.
get ready. So I think that's the mentality you have to have, is you look at sleep as the ultimate physician for the body.
Mhm.
It's
Mhm.
like the ultimate auto mechanic. You go in for your oil change every 3 years or whatever, and you get that done, and you have to have a good night's sleep, like your oil change. Otherwise, your engine dies ultimately.
Mhm.
And obviously, there's a lot of reasons for that. Sleep stages, non-REM and REM sleep, are associated with lots of different types of healing properties for all the organ systems of the body, all of them. And if you have disrupted sleep patterns because you're snoring and you have sleep apnea, or let's say you've been eating food that is hard to digest and difficult on the body, then that's going to interrupt those reparative processes, ultimately. and
Yeah.
therefore your body's going to age prematurely and be more susceptible to disease.
And I think you touched on one that I wanted to dig a little bit deeper in, but the effect of sleep on your brain and your memory. I think you were touching on this as we age.
Yeah.
But again, what's the impact of sleep on our brain and our memory?
Oh my gosh. I think of all of the things as I get older,
Hmm.
I worry more about losing. I mean, physically, yes,
Yeah, sure.
like I used to, but if I can't think like I want to, or memorize or learn, or be susceptible to Alzheimer's, dementia conditions, that worries me. And so that's a
Mhm.
really good reason to want to focus on sleep and getting good quality. Because, for example, if you don't get enough delta wave sleep, which is the stage 3 non-REM sleep, and also REM sleep, then your brain just doesn't have time to detox all of those toxins and proteins that are released from thinking so hard all day
Mhm.
and governing your body functions. Your brain is the governor of the body. Nothing works without the brain,
Yeah.
right? And so you've got to take out the trash every night. Body's got to get rid of that. And so if it doesn't, it builds up. Those are called beta amyloids, and that's diagnostic if there's too much of those for onset Alzheimer's.
Mhm.
And that's a real tragedy, obviously. So you want to get those stages of uninterrupted quality sleep to go through the detox to prevent, dementia and other things happening. Yeah.
Yes, I mean, if I think about those nights, those wild nights when I got very, very few hours of sleep, my brain was probably one of the quickest things that I realized, oh, this isn't working
Oh,
quite as well as it should,
oh,
for
oh.
sure.
Yeah, me
For
too.
sure.
Me too. All through dental school and
Hmm.
undergraduate work, I just remember being so tired. But I was in the prime of my life, and
Right?
I didn't know at the time that I had an airway disorder. And I was diagnosed in my 40s with obstructive sleep apnea.
Yeah.
And I just wish somebody would have told me. I had
Hmm.
cavities when I was younger. I had a
Hmm.
small mouth. I had teeth pulled because of my small mouth. And all of those things are indications. Small mouth means small airway. Small airway
Sure.
means apnea. So
Sure.
it's easy. Everybody on this call can look at their kid or their spouse today, look in their mouth, and if they have crowded teeth, not enough room for their tongue, they should be thinking, what's the quality of this person's sleep? Are they
Hmm.
struggling with any of these things we've been talking about? And let's get them screened and checked out. I wish
Right.
you would have done that for me.
Yep, exactly. Never too early and never too late to do either
Yes,
of those things. So,
yes.
Mike, tell me a little bit more about some of the other chronic diseases that sleep really plays a part in. Obviously, we talked about, um, Alzheimer's and dementia. What other chronic diseases does sleep really have a link to?
Yeah. Oh, wow. The cardiovascular system is, I mean, you think about what kills more Americans than cardiovascular disease. I believe that's number one,
Hmm.
if I'm not
Yep,
mistaken.
sure is.
I think about my parents, my grandparents, everybody in some ways had some effect from that. But essentially, the cardiovascular system is designed obviously to deliver nutrients throughout our body. And there's the pump called the heart that does that for us. And if we have obstructions where we're not breathing throughout the night, the heart is overly stimulated. And it's the brain saying, hey, I need oxygen. So it sends impulses and the heart beats faster and harder. The blood vessels will expand and contract based on the pressure of the pump. And over time, that excessive working of the system tends to wear down the system. And that looks like the form of um, arrhythmias, like
Mhm.
tachycardia, excessive heartbeats, or bradycardia, which is slower.
Mhm.
Or
Right.
it could be aneurysms, where actual blood vessels tear and you bleed in your brain or your heart or any other organ system. And
Hmm.
so it's just like anytime you overwork anything, you overwork your automobile, it's going to wear down faster. And
Absolutely.
so it's associated with that. If you have atrial fibrillation, which a lot of people do, if you have high blood pressure, which a lot of people do, then you should be looking at the sleep as a component, possible component to that.
Yeah, and what I'm hearing too, Mike, is, really the connection between, the person who's experienced this, but also bringing the dentist and the physician kind of all
Mhm.
into the same realm. I think a lot of the
Yeah.
time we really segment out those things. But again, I mean, everything you're saying is so important, and you may not be diagnosing things like Alzheimer's or diabetes or congestive heart failure. So really important to bring all those professionals together and have the same conversation.
Oh, yeah. Let's just dream big for a moment and
Hmm.
think about what the medical model could be in this world if we spend a little bit of time just screening for sleep
Yeah.
disorders, screening for nutritional disorders, screening for emotional disorders. All of these things will affect the ultimate sleep quality of a person. So it's not just blockages anatomically, like small airway, small mouth, but you could have been abused as a child and you still have those
Right.
memories, and your brain's receiving this supply of cortisol all night long because of those memories. And so I think in terms of anything that can overly excite the central nervous system, be it emotional, be it nutritional, be it obstructive in nature, any of those things have to ultimately be addressed. Otherwise, the sleep can't be to its optimum potential and provide those healing properties, like it
Yeah.
should. So dreaming big, I would say everybody in every role in healthcare should be screening their patients ultimately for sleep disorders. And it takes less than 30 seconds to do that. Looking in the mouth, looking at the neck, asking a few
Right.
questions.
See, yes, and I think that's so fascinating too, is, for all of our listeners, how many of you have ever had your physician ask about sleep? Very, very rarely is it, or they just throw like some question on a questionnaire in there and that's where it ends. It's just one
Mhm.
of those where it really should be one of the leading questions, but unfortunately, it's not.
I loved your video because you pointed out that how nice it is to have lower premiums for your health.
Uh-huh. Right.
And I did a dissertation recently, and one of my literature searches was about the healthcare cost for untreated sleep apnea. And the one researcher indicated it's $150 billion that's associated, direct costs associated with
Right.
untreated sleep apnea. And then
Yeah.
and then you don't even take into account the car accidents that have happened,
Mhm.
drowsy driving, or the
Right.
unproductive
Workplace. Yeah.
work, yeah, workplace issues and just those kind of things. It's a huge economic toll on our system. So why wouldn't we be doing this?
Right. I know. Everyone write that down, that we just need to start talking about sleep to everybody that we go and see from here on out. But at the same time, Mike, as we, think about our sleep and as we talk about sleep with our professionals, there's things that each and every one of us can do. What steps can we take to improve our sleep? Yes, we can ask the questions. Yes, we
Yeah.
can say, talk to our dentist to look in our mouth and see if anything looks funky. But what can each of us do to improve our sleep and maybe reduce the sleep problems down the road, if not already?
Yeah. So think about your mother or your grandmother, what they told you. That's a good
Mhm.
starting point because they said, one, eat your vegetables,
Mhm.
right? So that's all about the nutritional side. If you're not getting good balance in nutrition, the right amount of nutrition, enough protein, a lot of our diet are carbohydrates. And
Mhm.
carbohydrates are great for us. The brain loves carbohydrates. It's
Sure.
hard to get energy as quickly as it is from carbohydrates. But often we don't have a balance. We have an excess of that. And then, so from nutritionally, we've got to balance things out there. From an exercise standpoint, if we don't use our body and move it around, as soon as you
Mhm.
stop moving, you die.
Sad but true.
Sad but true. But so doing something, for example, eat dinner early on. Don't eat past 6:30 p.m. and then go out for a walk. Get your body ready for sleep. You want to get the digestive process working so that a lot of that food is well on its way of being digested before you go to sleep.
Mhm.
Because guess what glucose does to insulin, and what does insulin to natural melatonin release in the brain?
Mhm.
Well, it inhibits melatonin release. So why would you want the thing that's making you want to get sleepy and go to sleep in your brain, and because you're eating late. So
Mhm.
I know when you're younger, you can get away with that. You can sleep, but the older you get, the more you're like, okay, eat before 6:30 p.m., go out and go for a walk, get the body moving. But But then in addition to that, just a healthy lifestyle of exercise, 5 days a week minimum, 30 minutes of moderate to high intensity exercise is really key. And it's cardiovascular and it's also weight training. We have to strengthen the muscles because those strengthen the bones, and the bones are where the important immune fighting cells are being made for us.
For sure.
So those are two really good components. And then I mentioned earlier about the emotional, psychological side of
Huge.
sleep. Yeah. So if you're dealing with past problems where you've been a victim or a perpetrator, get help. Find somebody you trust and get help right away, because your sleep will be messed up even if you're doing all those really, really important things.
Yeah. Yep. And I think, one of the number one causes of stress in this world is, financial stress as well. So again, that emotional and, the mental emotional side is huge. So again, there's another person to bring to the table, like our dentist and our doctor. And, I truly believe everyone should have a therapist or a counselor, whether it be now or in some phase of their life, because man, life is not easy all the time. And so it's, you've got to address those things. There's nothing more frustrating than laying in bed in all worry and anxiety. You're never going to sleep that way.
Oh, for sure. Yeah, I agree with you, Tara. I used to think that it was, I don't know if I thought that, but it was the kind of the mentality was maybe it's a weakness if you need somebody to help you. And it's just so not the case.
No.
Just like a coach, would any basketball player just go out and play the game without a coach? Well, you could, but you're not going to be very successful.
Exactly. Yeah. Not long term, at least.
Yeah.
For sure. Yeah. If I do not exercise, I know that my sleep will be hindered for sure. Same thing, with coffee or alcohol or tobacco, any of those things as well, that'll zoom you up versus let you go to sleep.
Oh yeah, for sure.
Always taking into account the things that we're putting in our body that maybe we should pump the brakes on.
Oh, for sure. And you mentioned the stimulants, the caffeine, coffee, that's that side of thing. Isn't that the rage of this day and age?
Sure is.
Believe how much caffeine are in some of these drinks. I saw that it was 300 milligrams of caffeine in a drink.
Right.
Caffeine has a half-life of 8 hours roughly. And so you got, roughly 80 milligrams in your brain when it's time to fall asleep at night, and your brain's supposed to be calming down, not stimulated.
Yes, absolutely.
So that's a big tip, is limit the amount of caffeine. And if you're going to do it earlier on in the day so your body has a chance to metabolize that.
Absolutely. Yeah.
Go ahead.
Oh, go ahead. I was just saying, many people grab, dark chocolate or coffee. There's like the 3 o'clock slump, which many of us hit, that are in a job from 8 until 5. That 3 o'clock hour is a really tricky one. We want a nap or we want something to pick us up. One of the two of those.
Yeah. And I would suggest professionally that you just do a power nap, 18 minutes or less.
There we go. Yeah.
You don't want to get into REM sleep because it can mess up your sleep cycles. But for me, that works really well. If I just put my head down, even if I'm not sleeping well, for some reason, I just get energized and I can kind of push through. Yeah, you have Mexican food or something like that, which I love. 3 o'clock, if you've had it for lunch, that's going to be rough to push through all that.
For sure. Yeah, for sure.
But not a lot of people know about screen or light, excessive blue light on the system. Exactly. So you don't want to stay up in bed and watch TV. Better to read a paper book than to read off your
good old cell phones, good old technology.
Yeah, those are some good ones too.
Yep. I mean, it's very much our environment too. And I'm sure, Mike, we could, spend the next hour and a half talking about environment, but you just brought it up. I mean, those cell phones, the devices, the things that are in our sleep environment, in my mind, are some of the biggest culprits to why people aren't getting the amount of sleep. My husband and I have had this conversation on repeat for years, but the environment's huge.
Well, in my neighborhood, we've had dogs that will bark and it just penetrates right through our windows, our walls. And so that's tough. So we've had to use a little white noise machine. And it's helped.
Yeah.
And then a few other things we've done is we've blacked out the room so that no light can come through the windows. And we turn the alarm clock over so it's not flashing red all night long. And
Right.
anything that you can do to reduce the disturbances, the visual or audio, sight or sound disturbances in your room, then you'll have a better chance of having more quieted sleep.
For
Refresh.
sure. Yeah, we use a humidifier as our white noise. And
Oh,
for
yeah.
those of you who live in this dry state of Utah,
Yeah.
man, humidity is a kicker. And you wouldn't think that it makes a difference on sleep either, but it does.
Yeah, that's a great idea. That's also, especially when the heaters kick on, the heaters are zapping all the moisture out of our air, and the air conditioners are. So all year long, there's something taking our moisture out. So
Right.
I think that's a great idea. There's another thing too, is because of the dryness, we tend to have more kind of dry nasal passages,
Yeah.
which then means that we're going to be more susceptible to inflammation from antigens, stuff, bacteria, viruses that are going to collect on those dry inside our nose surfaces. So there's a product that I recommend using a lot. I don't have any monetary gain to it, but I use it personally. That is Xlear nasal spray.
Yeah.
Nate Jones is the founder of it. He and his dad, and it's just been wonderful. It's xylitol. It's a 5-carbon sugar, and it's sterile water, and you spray it into your nose. And the way you spray it, and as a side note, is really important because the nose anatomy runs parallel with the earth. So kind of parallel with your tongue. And so you point the bottle parallel before you spray it into the nose, and then that moisturizes those surfaces much better versus like when you see on the commercials and they show pictures of the nasal kind of following the angle of the nose. That's bad.
Right.
But something that tiny, that little detail makes all the difference in how treating the nose can be more effective too. So you can moisturize nightly. Often that will help to keep your nose clear and decongested too.
Yes. For sure.
Yeah.
Well, Mike, we're kind of rounding out, and I love to end all of our podcasts with your best 3 to 5 tips from your seat on the bus, from your dental seat or your sleep expert seat, your best 3 to 5 tips to help all of our listeners kind of move in the right direction and enhance their quality of life. So you can be on repeat. It could be things you already said, but 3 to 5 things that you would love all of our listeners to take away to make their life better.
Okay. Number 1, clean your nose and support your nose. Do what I just mentioned with the Xlear.
Yep.
Also use some nasal valve inserts. There's mute turbines, or there's magnetic nasal strips that can be used to open up the nasal valve portions. Set a consistent sleep schedule. Don't do 12:30 and then 9:30 and then 1 a.m. Just set it and be consistent with it, and shoot for 8 hours. For an adult, children are more than that. The younger they are, it's more than that, up to 16 hours for a newborn.
Yep.
And so make sure you're looking at your family. Go to sleepfoundation.org for those guidelines. That's an excellent place. And then optimize your sleep environment. Like I mentioned, black out your windows, cover your lights, get sound kind of obstructions set up, like we talked about, the humidifier, those kind of things. And then also during the day, eat those foods that will help you sleep. And then don't eat past 6:30. And if you're going to, make sure they're whole foods or something that's easy to digest. The worst thing you could do is something highly enriched with sugar or stimulants, etc. All right, now I'm on 5 or 6, but I'll throw out there caffeine. Reduce the caffeine intake. People are having strokes and heart attacks at earlier ages, diabetes, other things at earlier ages. And my personal opinion is that's a contributing factor because it's accelerating the nervous system too much and the body's overworking. So avoid that, and then exercise and do the best you can to treat yourself well, but then also go to your therapist and work through issues too.
Yep.
So we could keep going, but I think those would be some really good ones to hit, and it would give you a good jump start. And then, of course, go to your dentist or your doctor and be checked for sleep apnea. I told you a way to screen your children and yourself easily. And if you do snore, it's a high risk factor. It's not funny. It is kind of, but it's not, because that's a major risk factor for it. So get yourself checked out, treat yourself well. It's a great way to invest in your health. In the long run, you're going to spend a lot less money on medical bills and in suffering too, for yourself and your family.
Absolutely. And Mike, how can people reach out to you if they want more information, or maybe you're their guy and they just want to come and see you? Where are you at?
Yeah, so I'm in Provo, Utah at Advanced Dental Care. There's a website. You can just check that out. You can type in my name, and be happy to visit with you about your situation, you and your family, and just go from there.
And if people aren't located in Utah, obviously, we're a nationwide company. Do you have any resources outside of the state of Utah, or websites that people could turn to if they're looking for more information?
Let's see. I would say that sleepfoundation.org is a good place to go to. Let's see, there's the American Academy of Dental Sleep Medicine website. You can get information there. And I'm happy to actually personally visit with anyone. Just, you can call my office and they'll give you my cell phone number, and you can contact me that way. I know that's dangerous to let out your cell phone numbers, but I just love this crowd. Anybody who's taken their time to listen to something like this, to me, is just they're on the right track, and I'm happy to facilitate that journey they have going. So
amazing.
yeah.
Yes. And I'll put all those resources. I scribbled down the Snore Lab and the Snore Clock. So definitely check your show notes for your Rise Up with Orion podcast. I'll put all these in the show notes as well for those listeners who you maybe aren't scribbling down notes during the podcast, but maybe they'll re-listen and check that out.
Yeah. Yeah.
So,
can I add, Tara, one last thing? And that
absolutely.
is, there is so much hope for anybody who's struggling with chronic diseases. And identifying sleep disorders is just one of the steps, but it's a huge step. And it does help children and adults of all ages. And if a person's struggling with small mouth, malocclusion, dental, oral issues, but also systemic, heart disease, diabetes, cancer, Alzheimer's, anything like that, that sleep is, I think, an important place to start. There was a doctor that I interviewed a while back who's a cancer doc, and he said that his patients produce an excess of red blood cells because many of them have sleep apnea. And he and I surmised, wait, the body's producing extra little vehicles to carry oxygen because they're not getting enough. Yeah. And he's like, I need to screen these patients. And so there's just so many connections that just pursue this. If it resonates with a person, they should follow their feelings to the full extent. And then their family, they and their family will have lots of health freedom at the end of this journey. Sure. It won't be dependent on the medical world. I don't want anybody dependent on me to feel good. I just want to give them stuff and let them live their lives and enjoy it.
Yep.
Lots of
exactly. Yes, I love it. Thank you, Mike. I appreciate all the time that you've been willing to give myself and all of our listeners across the country today. And, obviously we'll give you full access to the recording, but for all of our listeners, this is the Rise Up with Orion podcast. Please tune in next month. We'll be revisiting our Orion book club, talking about the book Atomic Habits, for those of you that haven't read that already. But again, welcome all of you to circle back then. And Dr. Mike Bennett, thank you so much for joining us. I appreciate all of the expertise and your time today.
Thank you, Tara. It's great to be here.
Thank you. Have a great day.
You too. Bye.